My name's Dr. Ryan Bushman. I'm the owner-dentist of Spokane Family Dental. I told my entire team, hey, we're essential, we're gonna keep working, we're gonna try to do everything we can to work through this. And it's probably no more than 2 days after I say that the governor of Washington says basically dentistry is not essential. So I had to call my hygienists and my team and basically say, hey guys, we're not coming back to work. And the funny part about it is, a little tidbit is that was on my birthday this year, so happy birthday to me. I find out that no more than 8 months into business, we now have to shut down. I just started thinking up how can we stay essential, how can we, what can we do? And with the mandate that came through, it said emergency dentistry, and I wanted to provide the service we can for our patients and not shut down. So I kept someone in the office working just the phones, just initially, and I'd have 1 or 2 patients calling here and there, and I'd run in from my house, do a little bit of dentistry, and then go home. And the one thing that kind of changed is the way we did our dentistry. We went from having a schedule that we knew what was going to happen and what was going to take place to every single patient that came in, it was like, we got to see what's going on and we got to take care of it for them right then and there. Figuring out insurance information on the fly. We were setting up to do root canals and extractions and major procedures on the fly, and being able to adapt to the environment was a huge key of my team. So what we had to change was, as soon as they walk in the building, our front office takes their temperature, make sure they've either filled out the questionnaire online, which we prefer because then we don't have to have someone that says yes to any of these questions already be in the building, and then once that questionnaire is either done or verified and the temperature taken, we get them in the room right away. We did a lot more online messaging back and forth to patients, or talking on the phones, to kind of interact with them and allow them to be in a comfortable space for themselves if they weren't able to make it in. And that was another way that we screened patients to help make sure that they truly did have an emergency and need to come in. We have a lot of patients that came in and they were like, well, my dentist won't see me and you will, so we're coming to you forever, and they bring their whole family. Most patients see their dentist more than they see their primary care provider. So if we're getting their blood pressure, we're getting their temperature, and we're able to evaluate them as a whole, that helps them and their overall health a lot. So I think continuing that for sure is something we want to do. I would say to businesses that want to start now, start now. There's still people that want whatever you're trying to sell, you just got to get it to them in a way that they want it.